Welcome to Direction Northeast. Hello, I'm Katie Parks. This program is a presentation of the Communications Department of Northeast State Community College. If you haven't stopped smoking yet, then chances are you're thinking of quitting or you wish you had never started. This episode of Direction Northeast will take a look at how tobacco affects our lives and the lives of our loved ones and what we can do to prevent it. We'll meet our guest and start our discussion following these messages.
My name is Brad Ketcherin. I'm a registered nurse and I got my start at Northeast State. I chose nursing because it gives me the opportunity to take care of people. I know I'll always have a job and it gives me the opportunity to travel, which I've always wanted to do. So Northeast State was a great start for me. I was able to get my associate's degree there and transfer to a four-year college to get my RN license. I had always planned on going to college, but I wasn't really sure where I was going to go. After graduating Northeast State, I can truly say it was a good decision.
Our guest today is the Tobacco Prevention Coordinator for the Sullivan County Regional Health Department. She has also worked with the American Cancer Society as a prevention detection specialist, and now she is working with colleges such as Northeast State to bring an end to smoking. She has presented on a national, regional, and local level in tobacco control. Vicki Kasenberg, welcome to Direction Northeast.
Thank you, Katie. I'm so glad to be here.
First of all, how did you get started with working for tobacco prevention efforts?
Well, I was working nonprofit, actually for the Alzheimer's Association, and was a smoker. And I'm very upfront and honest that I was addicted to tobacco. I smoked about a pack a day. And one morning I woke up and I had a thought, I really need to quit this. And I just, that afternoon, I didn't think about it anymore that day. That afternoon, I got a call from my friend who worked at the American Cancer Society. And she said, I have this perfect job for you, but you'll have to quit smoking. And it was kind of the message that it was time to quit. And I successfully quit.
So you say quit. Why should people quit smoking? Why did you quit smoking?
I quit smoking because I knew of the health effects. I knew that it was harmful. Tobacco use is the single most preventable cause of death and disease in America. We know that if you quit, you will live longer. And it was just time for me, and everyone has a different time when they're ready to quit. One of the things that I tell someone is even if you've tried to quit smoking more than once, it takes the average person between 5 and 7 times to quit successfully, not to give up. It's never too late.
What are some of the dangers and risk of smoking?
Well, we used to think that it was just associated with lung cancer, but the Surgeon General's report, the 50th anniversary report, actually brought to light that it affects almost cancer of every organ in the body. So it's not just about COPD or lung disease or lung cancer, it's actually affecting the entire body.
So what are the benefits of not smoking or stop quitting smoking?
Well, the benefits are almost immediate. You know that as soon as you lay that first cigarette down that your body is starting to heal itself. And I think another benefit is that you're not exposing your friends and your family to secondhand smoke.
You say heal itself. Now, could a smoker who quits, could their body actually go back to normal as if a person never smoked?
Actually, they can. Over a number of years, you can actually get back to the place of being a non-smoker.
Now, secondhand smoke. Please explain to me what exactly that is.
You know, a lot of people have a misunderstanding about secondhand smoke. It can be the smoke from the end of a cigarette, or it can be the smoke that's exhaled from a smoker. And there's no safe amount of exposure to secondhand smoke. So we want to make that perfectly clear. It is dangerous. And if you are a smoker, we ask that if you have children to please take it outside and not to smoke in your car.
Is there more of a danger towards secondhand smoke than actually inhaling it yourself?
Actually, there is a danger. Just being around the secondhand smoke, there is no safe level of exposure to secondhand smoke.
Are there different effects, or are the effects the same?
Effects are similarly the same.
Okay. At what point does smoking become an addiction?
Well, nicotine is more addictive than heroin or cocaine. It's proven. And we know that about 48 million Americans smoke cigarettes. That's almost 1 in every 5 adults. smoke. So we know that it's hard to quit, we know that it's an addiction, and it has to be treated like an addiction. So we recommend that someone get support. There's a number called 1-800-QUIT-NOW, and it's a number you can call and actually get counseled over the phone to quit smoking. And they're not just going to send you a pack of information, they actually counsel you to help you quit. Statistics show that people that receive support are more likely to be successful in their quit attempt.
Now, as a past smoker, from your experience, what are the difficulties in quitting?
Well, you're going to have withdrawal symptoms. And the way that I quit isn't necessarily the best way for someone else to quit. It really depends on the person. We suggest that you talk to your healthcare provider and to figure out the best way for you to quit. There are nicotine replacement therapies. There's also the Chantix. It really depends on the individual. It's more of a custom program for each person.
So I've seen some people like chewing on pens, chewing gum, or some people actually turn to food as a replacement. Do those methods work, and did you have any of them?
Actually, I chewed a lot of sugar-free gum, and I carried a pencil around actually because you have that physical touch component of it. It really just depends on the person. We want you to find coping mechanisms. We want you to know what you're going to do instead of smoke, and we want you to have a plan in place before the urge happens. The bottom line is the urge will pass whether you smoke or not. So if you wait long enough, the urge will pass.
So a person could actually get over and not have that urge to smoke anymore.
That's correct.
So we're talking about the physical aspects, the actual smoking, and then the replacement of chewing the gum or biting the pencil.
Right.
Is smoking, the addiction to smoking, is it a behavioral problem or is it a physical problem, or both?
It's actually both.
How so?
We know that it affects the brain. We know that the nicotine is a chemical and it affects the brain process. But it's also a psychological addiction. So it's a dual sword.
There are methods to stop the physical part of smoking,
Yes.
the patch and the different ways. What is the way to stop the behavioral effects of smoking?
I think having a plan in place. I think knowing what you're going to do instead of picking up a cigarette.
In your experience, when you're trying to get one of your friends or family to stop smoking,
Yes.
what do you say to them?
Well, we never want to guilt someone because we know it's an addiction. I just give them support and tell them that, it takes the average person I mentioned earlier 5 to 7 times to successfully quit, just to not give up. It is possible. You can quit. You can do it, and there is help out there.
What is the most frustrating part when you're talking to one of your friends or family members and you know that there are risks in, like cancer, that are could have death
Absolutely.
involved in them? What is the most frustrating part when talking to them?
I think that I know how difficult it was for me to quit. It wasn't easy, but I know how much better I felt, and I would just encourage them to know that they can feel better, and that although it's difficult, it's not impossible.
What about the person, because I've heard this when I say, well, you need to stop. I've heard people say, well, it's my body. I can do whatever I want. People who have children and who have loved ones, why do they say this, and how can we help? What do you say?
Well, we never want to see children or another adult exposed to secondhand smoke. We know that about 388,000 people die from exposure to secondhand smoke. So we want to encourage them that if they are going to smoke, and it is their right to smoke, that they not do it around other people, and that they certainly not do it around their children.
I've seen a few ads promoting the cessation of smoking.
Yes.
One of the ones that sticks in my head is the one where the old man is sitting in the wheelchair. But it starts with a beautiful young lady who looks like she's in a movie set, and then she's got a cigarette between her lips. And then it turns into this ugly, wrinkly man, and you see him on a breathalyzer. How is this shocking awe process of these ads. Is it working? How's it going about it?
Actually, it is. The Centers for Disease Control came out with a program in the last couple of years that actually focuses on real live individuals that were former smokers. They have individuals like a woman that had a baby that was premature, a gentleman that lost all of his teeth due to smoking, another person that actually has emphysema and is unable to breathe on his own. And I think even though it is a shock and awe commercial, they're real life people. And that really hits home with a lot of people. CDC saw an increase to their call numbers and saw that it was a really effective program.
Now, earlier you said that you had to stop smoking for the job that was offered to
Yes.
you. Some employers are actually requiring, if you are hired, they're requiring that you not smoke.
That's correct.
Is this an extreme take? or
Absolutely
extreme protocol?
not. The bottom line is that smokers are at higher risk for health effects, and when you look at insurance, it's all about policy change, and we see it a trend across the nation, and it's going to continue. The American public cannot continue to pay for medical expenditures from smokers when they know it's something that if they do stop, they're going to have a better life.
On a larger scale, talking about the United States as a whole, what is the growing tobacco use problem? What effects has it caused on our culture and our society?
Well, as far as our culture, we are from East Tennessee. We know that this is a tobacco community. One of the things that I tell everyone is that we are not opposed to farmers. As a tobacco control advocate, my role is to understand the problem, and we see the farmer actually suffering at the hands of the tobacco industry because the majority of tobacco produced in America actually comes from overseas. It's not an American crop anymore. And so the farmer has really suffered at the hands of the industry. So we're never opposed to the farmer. This was something that we all grew up, and farmers had their Christmas crop, is what they used to call it. And that was that little bit of extra money that they got from their tobacco acreage. And so we just want to make it clear that it's not about the farmer. The farmer suffers.
Have you ever experienced like working on a tobacco farm or seeing like how did you grow up with tobacco?
We didn't have tobacco. I grew up on a farm, but it was very much embedded in everyone because I grew up in a rural area. Everyone had 2 or 3 acres of tobacco that at the end of the year, that was their Christmas cash. That is how they made their extra money each year. And it was a very important part of their livelihood. And as the industry went overseas, that diminished for the majority of people, and they had to switch to alternative crops. Things like soybean in Middle Tennessee is one of the crops they switched to. They looked at green peppers. Of course, it's not as fruitful as the tobacco crop, but it was something that they had to make a choice and do.
What can we do as a country to help the tobacco farmers?
Well, I think that our dependence on tobacco, we've seen that the industry is going overseas. I don't ever foresee, of course I'm not an expert in that field, but I don't see that tobacco coming back as a major crop for the U.S. anytime soon because they can actually get the tobacco cheaper and there's less regulation out of country. So as far as the farmer goes, we want to see them be fruitful in other crops outside of tobacco.
Did your parents smoke?
Actually, my parents did smoke, and I was around smokers growing up, but then we didn't know the health effects of tobacco. It wasn't until the 1964 Surgeon General's report, and then again the 50th anniversary where it talks about secondhand smoke. When my parents were young, we just didn't know the risk factors of smoking, and now we do. There's so much we can do about it.
Did they have any of the health side effects that you listed earlier?
Actually, they didn't. We do have cancer in my family, and not every smoker is going to die of lung cancer, but they are going to be affected in some way.
The new in thing are e-cigarettes or
Yes.
electronic cigarettes.
Yes.
What are they and how are they different from regular cigarettes?
Oh, well, electronic cigarettes is a very hot topic now. And the bottom line about electronic cigarettes is that there is no scientific evidence to prove that it's going to help someone quit using tobacco. And there's no FDA regulation on electronic cigarettes. So we do not know what's going in the electronic cigarettes. There's no oversight at all. So we can't safely say that that's an alternative to smoking. So I would encourage someone, if they're interested in quitting, that they use one of the nicotine replacement therapies, not electronic cigarettes. And I hear a lot of people say, well, it's just water vapor. Well, it's still a vapor, a burning vapor, and we just don't know the health effects. We believe that vaping will be the new smoking. And vaping is someone that uses an electronic cigarette, they vape. Someone that smokes, smoke. We do believe it's going to be a public health epidemic.
I've seen a lot of restaurants say no e-cigs
Exactly.
on here, whereas the whole advertisement for e-cigs is you can use them anywhere.
Well,
why is this happening?
what's interesting is who do you think is making those commercials for the electronic cigarettes?
Well, the e-cigarettes, of course.
Right, the tobacco industry. And so they want to present it as a safe alternative to smoking, and we just don't know. So they're making a culture almost, and they're making the American population believe that it's safe, and we just don't know. One of the reasons that people are banning e-cigarettes is because of the secondhand vape. So we have secondhand smoke, we have secondhand vape. We do not know the health effects. We do not know the exposure. So my recommendation is that if you're looking to quit, find something that you know that works, that's proven, that's research-based. It's not necessarily the electronic cigarette. Another concern we have is that of all the fruit flavors, cotton candy, strawberry, bubble gum, this leads us to believe that perhaps the marketing is going towards youth. And we are seeing more youth trying electronic cigarettes, although it's illegal in the state of Tennessee for them to purchase.
Do you believe that e-cigarettes, the market for e-cigarettes, will actually replace the market for tobacco?
I don't know that tobacco will ever be gone, but it is a huge industry. And electronic cigarettes were introduced, they were invented in 2003. They were introduced into the United States in about 2006. And the industry, the tobacco industry, first said, well, this will never be our competition. And what they learned very quickly was that it became their competition, and they wanted to get in on the game. So I don't know that tobacco will ever be gone, but we do see that it's going to be a public health issue.
As far as the future goes, what do you see for tobacco prevention? Will we eventually see tobacco done away with in America?
I don't know that tobacco will ever be gone, but in comprehensive tobacco control, we work primarily in 4 areas. And these are areas we really want to focus on. The first is preventing youth from initiation. We don't want those kids to start smoking at any age. The second is that we work on exposure to secondhand smoke, which we've discussed. We want to protect people. It's no longer safe to be around tobacco smoke. The third area that we work in is helping youth and adults quit. We're not here to make anyone feel guilty or bad about their addiction. We're here to help them quit. We know that quitting can be successful. And then the last area we work in is disparate populations, or populations that maybe have a cultural gap. In our area, it's pregnant smokers. So that's the 4 areas that we work in, and it's a huge undertaking, but I do think that we've been successful, and we will continue to work forward.
You mentioned youth. Now, you've been working with some of the schools
We
in the
have.
area. Why are you targeting schools to focus on prevention?
Well, I think anytime we can get that education to our young people, the earlier the better. And I think that it's a great avenue. It's one of those areas of comprehensive tobacco control. And in schools, we're actually able to go in and have a captive audience. So it just makes sense that we're in school. We also work in after-school programs and clubs. So there's a variety of avenues that we can reach that youth population.
You were talking about a comprehensive tobacco program,
Yes.
control program. What are the components of that? How does it work?
Well, what we look at is instead of working in just one area, like we're only going to focus on youth initiation, or we're only going to focus on quitting, or we're only going to focus on secondhand smoke, we approach it as a four-pronged issue, and we work in a variety of different areas. So it has different components, and we kind of address the issue comprehensively, or more than just doing one thing. We know it takes working in all four areas for it to be successful.
So it's not just a step-by-step program, you're working in all.
Exactly.
Now, are there any requirements for participating in this program? How can we get started?
Well, one of the things that we're looking at in Sullivan County is we are looking at establishing a tobacco control coalition. So if anyone has an interest in working in any of those four areas, you know, they can call me at my office at the Sullivan County Regional Health Department, and we're always looking for volunteers to help us with our cause.
Why, let's see here, where to go next? What steps have you seen, going back to colleges, what steps have you seen colleges take toward preventing smoking?
Well, we see a lot of policy issues, and again, you will hear me say policy over and over and over. That's one of the ways that we're going to change the current environment. So we're very excited about partnering with Northeast. We are working on a Clip It to Win It hashtag Smokeout event. And what it is that we are giving the students an opportunity to come up with a 20-second clip that involves secondhand smoke, and to post it on Northeast's Facebook page. And the winner of the Clip It to Win It program will actually win an iPad mini. So we're encouraging the students to get involved and help spread the word about secondhand smoke. The contest runs from November 3rd through November 17th, and we're very excited to see the results. We want to hear from the Northeast students, and we're excited about the program.
Going back to college students in general,
Yes.
If one wants to quit, how can they go about doing it?
I would suggest that they call 1-800-QUIT-NOW. That's the toll-free number in the state of Tennessee where you can get counsel over the phone. There's no cost for the program. You actually get a peer counselor, and it's just a great way to take that first step, and they can actually help you figure out a plan.
Going back to the different types of tobacco, what do you think about smokeless tobacco? Is it a good alternative?
Actually, it's not a good alternative. Tobacco is tobacco. So spit tobacco is just as dangerous as smoking cigarettes. We see more oral cancers, and so there's a variety of health issues that can come with using spit tobacco as well.
Okay, so you're up there in front of your senators or
Yes.
your lawmaking body, and you're giving your pitch to outlaw smoking and tobacco and all those products. What would you say to them?
I would say that it's time that we take our health back. You know, I don't know that we need to outlaw tobacco, but I do think that we need to change policy as far as smoking in public places, things like parks, and being able to restrict other people's exposure to secondhand smoke. A non-smoker doesn't want to be around smoke because of the health effects, not because it's an inconvenience.
So, do you think the right to smoke for a person's right to smoke is more important than a person's right to not be?
I think it's when it becomes a health issue, it is the individual's right to have a clean air to breathe.
I know Tell us about your past and current efforts to prevent smoking.
Sure.
I know you worked with the American Cancer Society and then on the regional level. What are the difference between the national level and the regional working with those?
Actually, there's not a lot of difference. It's interesting. After I left the American Cancer Society, I went to the Knox County Health Department and was the tobacco prevention specialist for them. And tobacco control is, it's a science now. And so regardless of whether we're at a local, regional, or a national level, the CDC best practice recommendations are the same. In Knoxville, when I worked there, I was very involved with, I was the facilitator of Smoke Free Knoxville, which is a local tobacco control coalition. And they worked in those 4 areas, and that's what we're hoping to do here in Sullivan County.
What would you like to see happen with tobacco products in Sullivan County?
I would like to see, first of all, I'd like to see some regulation on electronic cigarettes and regulation on advertising, but I'd like to see that at a national level. In Tennessee, I'd like to see our health rates improve. We know that the Sullivan County has a higher smoking rate than the state of Tennessee. And I'd like to see those rates decrease. We've got a strategic plan for 5 years. It'll take much longer than 5 years, but we are actively working to try to really reduce the burden of tobacco in our area.
You say burden.
Yes.
How is it a burden?
It is a monetary burden for our community with health care costs related to smokers. It is an epidemic of proportion. I mean, it is an enormous problem in our area, and I'd like to see a healthier Tennessee.
One final question. Earlier you said regulation on advertising.
Yes.
What is the effects of advertising, first of all, and what regulations would you like to see?
Well, I'd like to see the tobacco industry, we're actually regulated as far as tobacco products and advertising back with the Master Settlement Agreement around 1999. But there is nothing in place for electronic cigarettes. So when you walk into a convenience store, it is everywhere, and it's being perceived as a safe alternative to smoking. So I'd really like to see some advertising regulations that aren't geared towards youth, that we stop looking at the fruit flavors that would actually attract youth initiation. And I would like to see some of the point of purchase materials be regulated. It is perceived as it's just a safe alternative, and it's not. It's just not.
Thank you.
Thank you.
We'll be right back in just a moment to wrap up Direction Northeast.
My name is Jason Tipton. I'm a manufacturing technician for A.O. Smith, and I got my start at Northeast State. As part of my job here, I do design work with CAD, and those plans are implemented throughout the factory. And I continue to use a lot of what I've learned at Northeast State on a daily basis. I'm the type person that likes working with my hands, and now that I've got a degree from Northeast State, I'm able to do something I enjoy. In manufacturing, it's important to have the right tool for the job. Having an education from Northeast State has been that tool for my career.
That concludes the program for today. We have talked about the social and physical effects of cigarette smoke, and part of the effort to prevent and stop smoking. Community is very important to the students at Northeast State Community College, and this program takes a look at a few of the subjects they find important. Until we meet next time, on behalf of the students, staff, and faculty of Northeast State Community College, I'm Katie Parks, and this is Direction Northeast.